I had a family history of breast cancer on my father's side. My grandmother had breast cancer, and both of her daughters had breast cancer in their 40s. And every physician told me, because it was on my father's side, that it was never an issue for me to be concerned with having breast cancer. Around Valentine's Day, I felt a lump on my breast. And as I stated, every time I feel something, I would go to my OB and they assessed the issue. They did not feel a lump. And because they didn't feel a lump, I had to go to the breast center on my own and schedule an appointment if I wanted further testing. I continued to advocate for myself. Well, around the same time, my sorority, Delta Sigma Theta Sorority Incorporated, was having a webinar. One of the ladies there worked at the breast center. She's in the sorority, but she was on the panel as well. And this was my first time really meeting her. And so, ironically, she came and sat next to me after her presentation. And I shared with her my family history and that I felt something. And she gave me her cell phone number and she told me to call her the next day. She was the one to recommend that they talk to me about genetic testing. I never knew that was an option, did not know it was a thing. So I instantly had to become an expert and first understand what BRCA2 was, what it meant, and also make a decision. I didn't want my family to have to take care of me. I actually had to wrestle with the decision by myself first before I shared it with my parents. I shared it with my husband, but I wanted to be confident that I was okay with the decision that I was about to make. And I'm grateful also for the program that we have here in Tyler. And it gave a name to what I did. And so now, not only am I Veronica Tucker, but I'm Veronica Tucker, a pre-bot.
This is Genetics for Healthcare, a podcast for patients.
Welcome back to another episode of Genetics for Healthcare, podcast dedicated to patients and their family members to help them figure out this world of genetics and genomics and how to advocate for a precision medicine approach to their healthcare. It is February, and February is National Cancer Prevention Month. Now, we know that we can prevent cancer diagnosis through healthy diet, exercise, good habits, but did you know that you can also make these cancer prevention decisions through genetic testing? Today, we are privileged to have Veronica Tucker to share her genetics for healthcare journey and how genetic testing impacted her decision for cancer prevention. Veronica, thank you for joining us and being a guest on the show.
Thank you so much for having me and bringing awareness to this great cause.
Well, tell us about your life, your family. Where are you from? And tell us about your family.
Okay. Well, again, I'm Veronica Tucker, born and raised in Memphis, Tennessee. Lived in Huntsville, Alabama for 12 of my adulthood, and then recently moved to Tyler, Texas 4 years ago in 2021. And Tyler, Texas completely changed my life. And I'll get back to that. But I am married. This year will make 20 years for my husband, Archie Tucker. I don't know if you guys are familiar with the comics Archie and Veronica. And so that's our beautiful love story. And we have two boys. One is Jordan, 18. He's a high school senior, preparing to go off to college. And then we have a 14-year-old, Austin Tucker. So I am a mom of boys.
Well, I met you in Tyler, Texas, with the great Kathy Baker, great friend of the show, who has a cancer survivors and previvors banquet that she has every year. She invites the life science industry to Tyler, Texas, and she is an absolute force, not only in changing political policy to help folks access genetic testing and make powerful life decisions, but she also shares her story. Did you have a family history of cancer? How'd you come into the knowledge of genetic testing?
Yes, I had a family history of breast cancer on my father's side. My grandmother had breast cancer, and both of her daughters had breast cancer in their 40s. And every physician told me, because it was on my father's side, that it was never an issue for me to be concerned with having breast cancer. But every time I felt something, I would always go to the doctor and they dismissed it. One, because of my age, and because of it being on my father's side. More recently, I had a uncle who was diagnosed with a brain tumor, and that's really what got me into patient advocacy. And I'm grateful also for the program that we have here in Tyler. And it gave a name to what I did. And so
Mm.
now, not only am I Veronica Tucker, but I'm Veronica Tucker, a previvor. So being able to do the preventative methods to save my life.
So we talk about a lot, and I appreciate you for sharing that, the stories of you engaging with healthcare providers who were misinformed around the utility and the usefulness of genetic testing, or knowing genetic variants.
Yes.
And it's changed over the years because for many years, it wasn't reimbursed or covered through insurance. And so there was a big, fear around the costs associated with it. But can you tell us, when was germline genetic testing or hereditary cancer testing introduced to you? How'd you find out about it? And was it due to, the events that were happening in your family?
So actually, 2 years ago this month, around Valentine's Day, I felt a lump on my breast. And as I stated, every time I feel something, I would go to my OB and they assessed the issue. They did not feel a lump. And because they didn't feel a lump, I had to go to the breast center on my own and schedule an appointment if I wanted further testing. Well, I called the breast center and they told me that they didn't have any appointments until 6 months out. And so
Yeesh.
to feel something and to be told that you have to wait 6 months was just, it was hard. And so I am not one to just take information and sit on it. And so I continue to advocate for myself. Well, around the same time, my sorority, Delta Sigma Theta Sorority Incorporated, was having a webinar on healthcare and access to healthcare. And one of the ladies there worked at the breast center. She's in the sorority, but she was on the panel as well. And this was my first time really meeting her. And so, ironically, she came and sat next to me after her presentation. And I shared with her my family history and that I felt something. And she gave me her cell phone number and she told me to call her the next day. Well, she got me in at least a couple of days after that. And unbeknownst to me, she had already had a conversation with them, telling them my family history. And she was the one to recommend that they talk to me about genetic testing. I never knew that was an option, did not know it was a thing. I'm also terrified of needles and doctor's office just from childhood trauma. But when they told me that genetic testing was simply putting saliva in a tube to see if I had the gene, and that it was covered by insurance, that it was free, it was easy, and so I said, why not? What do I have to lose? I'm already terrified that I have a history of it, but they're telling me that it shouldn't be a concern. And so I took it. It took a couple weeks for the results to come back. And when I got the letter in the mail, it really didn't make sense because I had a follow up appointment at the cancer center. And my husband, when we got the letter, he said, well, I'm coming to the appointment with you. I said, I don't think it's anything. But he saw the fear in my eyes. And he was like, no, I'm going to join you at this appointment. Well, I stopped listening when they told me that I was BRCA2 positive and the genetic risk that I had. And so I had a higher risk for breast cancer, ovarian cancer, and melanoma cancer. Well, my melanoma cancer risk was really low, but breast cancer and ovarian cancer were really high. And they say that most women don't find out they have ovarian cancer until it's too late. And with the breast cancer, I had two options: either go every 6 months, alternating a MRI with contrast with a mammogram. Well, with a 40-50% chance of getting breast cancer, I didn't want to wait and see. And as I told you before, I have a husband of nearly 20 years, two boys that I just love dearly. And I didn't want to wait and see. And I didn't want them to have to take care of me because I am a big baby and I don't take sickness well. And so I wanted my kids to be able to live their life out loud without having to be caregivers at an early age. And so I instantly had to become an expert. Am I going too far into the story?
No, no, absolutely. Just
Okay.
go for it.
So I instantly had to become an expert and first understand what BRCA2 was, what it meant, and also make a decision. The lady who I encountered at the cancer center was absolutely fantastic in sharing the information and talking through it with my husband. As I said, I stopped listening at a certain point, but she left us with information. She did a follow up after the call, and she also recommended places for me to go.
Hmm.
Well, we went home, and
Now,
I
was
had
this person a genetic counselor? Who's the person that you guys were meeting with?
Yes, she was a genetic counselor. So she had a
Okay.
back office in the cancer center, but just even walking through the doors and in the parking lot of the cancer center just terrified me. I didn't know what I was walking into, but she's a genetic counselor. And I can see myself walking into the office space. And it was so, I can't say the room was inviting, but she was an inviting person. And she really was passionate about what she does. And she knew the news that she had to share with me, and she did it in a very informed and compassionate way. So that I didn't leave there broken, but we left there empowered to be able to do something about it. And so the good thing is, I was diagnosed, but I had options. And oftentimes we don't have options. And so I did leave there being very thankful that I had options, and she shared my options with me.
Well, first of all, shout out to Delta Sigma Theta uh, from the Noops
Ooh.
and all the Divine Nine,
Yes.
raising awareness in our communities because African American women, even though they have lower prevalence of being diagnosed with cancer, have um, the most deadly outcomes from being diagnosed with cancer. And it's amazing when you look back on your story and people you're denying, it's nothing. We don't feel anything. You might feel something, but you're an expert in your body. You're an expert in your condition. They see you maybe for 15 minutes. They don't feel anything. What empowered you to continue to advocate for yourself? And even through them telling you that, oh, that was on your father's side, which was a common misconception in years past from clinicians around genetics and inheritance. When you look back on that, like, how does that make you feel? And what does that do for your motivation to share your story and experience?
So as I stated before, I am not one just to take information. And as you stated, we know our bodies. We know when things are off and they don't feel right. And so I'm gonna push until I get answers. And I'm confident that the answer they're giving me is an informed answer and not a dismissive answer. And so it was scary, it was frustrating, and I was also upset because pay my premium every month for healthcare, and all too often the doctors are concerned about not even healing you, but putting a band-aid on the issue. And I want to get to the root cause of it. What is causing this issue? Why do I feel these lumps every month? And again, my sorority sister educated me. She said when you go and get your mammograms, you need to understand what type of breast you have. And I didn't know that at 40 years old that there's a difference in the breast type. And so some women have fatty breasts and some have dense breasts. And depending on what type of breast you have during your menstrual cycle, you can have certain symptoms. And so I had fatty breasts. And during my menstrual cycle, according to research, it is common for you to sometimes feel lumps if you've had a lot of caffeine or coffee or chocolates. And I love chocolates, and most women love chocolate and caffeine around that time. And so, of course, I'm consuming those things. But to be educated that I had a higher chance of getting lumps if I did do those things helped me to move differently. But again, I continued to push the issue because I didn't want my family to have to take care of me. I actually had to wrestle with the decision by myself first before I shared it with my parents. I shared it with my husband, but I wanted to be confident that I was okay with the decision that I was about to make. And like I said, I didn't want to wait and see. And so I knew I had to do something about it. And so once I came to terms that we already had children, and so the total hysterectomy was not a question for me. But the double mastectomy raised concerns because I can vividly see how my grandmother's breast looked after her mastectomy. No, she didn't have a double mastectomy. She only had one breast removed. And the way the reconstruction was done for my grandmother was absolutely horrendous. I mean, I
Mhm.
still to this day have scars from just seeing how her chest was put back together. And so once I made the decision that I wanted to remove the risk out of my body, I went to my husband and shared it with him. He was in absolutely 100% agreement with me. He said that he's a leg man and breast didn't matter. And so he told me I had big, beautiful legs. And so whatever decision I wanted to make, he supported me. And then once I was 100% confident, that's when I had to go and tell my parents that I am going to have a double mastectomy without reconstruction and a total hysterectomy. Total hysterectomy. And so when I first shared it with my mom, she was like, "Well, do you have cancer?" I was like, "No, but I also don't want to get cancer." And so it was hard for my family to understand why I wanted to go through these radical changes to my body. And I didn't have cancer yet in my body. Well, fast forward 2 months later, my father had prostate cancer and he underwent surgery to have his prostate removed. Well, his PSA numbers kept rising. He also had a brother who was in a healthcare facility for seniors because of dementia. Well, my uncle was also having prostate issues. And so the healthcare facility called the entire family in. They didn't know why they were calling them in. But they actually called them in to do a webinar on genetic testing. And so thank God the doctor educated my family. And my family calls me Ronnie. And so at that moment, they understood why I did what I did. My dad also tested positive for BRCA2 because they couldn't figure out why his PSA numbers kept rising. And so they did the genetic testing on him. And so both of us are positive for BRCA2. And men can develop breast cancer as well. And so now I know the risk for my boys. The consumption of alcohol and different things can increase their chances for breast cancer as well.
I think that's an incredible story that comes full circle, um, from your grandmother, your aunts, going through your dad and his siblings to come into the knowledge of how genetic insights can help you be proactive
Mhm.
to make these decisions. And it is unfortunately the case that many people are diagnosed with cancer, and even then, genetic testing or hereditary cancer testing is not even recommended for them
Yeah.
because they really want to address the cancer first. And so they do everything they can to treat that person with cancer, but they end up leaving that clinic without the knowledge of, oh, by the way, you can find out whether this is hereditary, driven by
Yes.
hereditary germline genetic genes that you inherited from a mother or a father
Mhm.
that will increase your lifetime risk of this. Oh, and by the way, it also may increase the lifetime risk of your sons or daughters or
Yes.
your nieces and your nephews. In social circles, you mentioned that your family was able to come around. In our social circles, our church family, our fraternities and sororities, even though we talk about early detection, there's not enough conversation around prevention
Yeah.
and how we can use this information to prevent. Have you seen these your sorority or other circles, especially in the African American community? Have you seen incidents where people are being more engaged around prevention
Yeah.
and understanding that genetics plays a role in that?
Absolutely. Yes, I will answer that question, but I want to take advantage of having the opportunity to speak on this platform. I had the great fortune to know that I was BRCA2 positive and to be able to do something about it. And so that, yes, that is a brave story, but it did not go without um, some hard choices and some painful things happening to me. And so I want to take advantage of this platform to truly share my full story, not just the beautiful story of identifying that I was BRCA2 positive, but what happened to me as I was navigating the medical industry. As a strong, educated woman who, like I said, was helping my uncle, I too had problems navigating the industry. My surgeon for my double mastectomy was absolutely fantastic. But when it came to my OBGYN, the one who first dismissed the issue and also dismissed other symptoms that I went to her about, I went in for a biopsy because that's one of the first steps before the procedure is done to be ensured that cancer has not entered your body. And so this is all new to me. I'm fairly healthy person before this, void of any major issues. And so not knowing what a biopsy is and to go into my OB's office without warning, without training, education, she takes a large pair of scissors and clips something off of my uterus, which was absolutely painful to me. I screamed, I cried. She left out of the room and they came back in the room with a little tray that had a little pill on it. And they left me to go about my day. And so I want to educate women to know, like, once you go through the genetic testing, and if you do find out that you are BRCA2 positive or BRCA1 positive, that there are still additional tests that you have to undergo. Not just a simple saliva test, but having to go through the biopsy was a lot, and I wasn't informed. They dismissed me on so many levels that it just breaks my heart. And they're
Mm.
also protected. So nothing I could do to hold them accountable because they have so much protection around them. But my goal in this is to protect the patients, to inform them, and to educate them. Well, I go through my total hysterectomy 6 weeks after my double mastectomy. Just because life was happening, I had to have both procedures back to back, 6 weeks apart. My OB knew this. I also had talked to her about heavy menstrual cycles, heavy bleeding, clotting, and things like that, thinking that I was perimenopause. She said because of my age, that it was not an issue, but I had all the symptoms of it. Well, I go through the total hysterectomy, having my ovaries removed, and all of this is a loss. Losing my breast, losing my ovaries, even though I have kids, it is absolutely a loss.
Yeah.
And at some point you feel like you're losing your womanhood, but I'm so grateful that I had people around me to encourage me, and to remind me that I'm still a woman, that breast nor my ovaries define me. Well, after the hysterectomy, my OB, we go back 2 weeks later. After my procedure, it's an outpatient procedure, and they release you. I didn't get an update that everything was successful. I was the last patient of the day. 2 weeks later, I go to my follow-up appointment, and my OB is in there, her assistant, and my husband are sitting there. She shares with me that my uterus was so large. She asked me if I had problems urinating, and that she found like mass and endometriosis in my body. And I simply asked her in this same tone, and maybe a little less because again, I'm still recovering. I said, how did we miss that? How did we miss all of those things? Because I was just going in for a hysterectomy because of the BRCA2, not because she found anything. And she immediately got offended. And she told me that I needed to go to someone that I trusted. Again, I'm 2 weeks out from my hysterectomy, 8 weeks out from a double mastectomy. So I'm a very vulnerable. And I didn't say, how did you miss it? I said, how did we miss this? And and she gives some explanation. But then a couple of days later, our doorbell rings. I have a certified letter from my OB stating that her nor anyone else at the practice would see me as a patient.
And why is this?
I still want to know that myself. It said breach of patient physician something. But
Hmm.
she dropped me as a patient because I asked questions. She found things in my body that she missed before. And so she was protecting herself. 2 weeks after my surgery, I'm not completely healed emotionally, physically. And that was just another jab. And so I wanted to share that one,
Mhm.
because the physicians are so protected that you go through these traumatic things in your life and you make these brave decisions all to be dropped from your physician because you ask questions. And and two, so that women understand like it's still and men as well. When you make these brave decisions, it doesn't just stop there. And I
Yes.
thought it did. I thought once I have the double mastectomy, once I have the hysterectomy, that was all that I would have to go through. Well, fast forward a couple of months later, I feel something again in my chest. And so I have to go through a biopsy again. And I cried out like I thought I was done. But
And
this
so
time
who'd you go to for this biopsy?
I
Was it
went
a breast
to,
surgeon?
it was the breast. Yeah. That
Okay.
was my first time having the breast biopsy
Okay.
because they didn't find anything in my breast before. So this was my first time having the breast biopsy. And so it wasn't my surgeon, but it was in the same office. And so they were familiar with me. He saw how nervous and upset I was, and he took time. He stopped and he educated me because I was traumatized from the first biopsy, and I thought this one was going to be the same experience. And women who have undergone an OB biopsy can tell you how traumatic it is. Now, for those that have high pain tolerance, it's probably not that bad for them. But those that have a very low pain tolerance, it's a very traumatic experience, especially if you're not educated and aware of what's going to happen to you.
Well, that is a note for anyone out there. And this is what my platform is all about is patient information and empowerment. We want not only to talk around genetics and genomics to be informative. We want to give people the language and also the confidence to go advocate for themselves. But in this particular instance, I think it's just as important to advocate for yourself because in many cases the doctor is the smartest person most
Yeah.
people know or will come in contact with.
Yeah.
So whatever they say, if they say I should do it, I should do it. If they didn't mention it, it must not be important.
Mhm.
But we really want to empower you to advocate for yourself. If something doesn't feel right, if you don't feel like your clinician is listening to you, if you feel like your clinician is talking to you in a way that is over your head
Mhm.
and you don't feel empowered to say, I don't understand that. This is why we do the show. And this is
Yeah.
why we have people like Veronica on to share their experiences so you can be empowered and build that confidence to advocate for yourself, not just in the area of genetics and genomics, but for letting your voice be heard and getting the care that you want, you need, and you most importantly deserve.
So I want to answer your question now. You asked me about community. And
Mm.
so, yes, the conversation is happening across communities now, thankfully. And it probably was happening before, but my ear is more aware of the conversations. Not only am I a member of Delta Sigma Theta sorority, I'm a member of the Links Incorporated. And the Links Incorporated gave me the platform to serve as an ambassador for the American Cancer Society. There is an association for Black women that have cancer. And so I am an ambassador for the American Cancer Society to help raise awareness. But every opportunity that I get, I'm sharing my story with everyone. My husband does not recognize the woman that I am because I'm so open about the situation. I would even show my chest to women because when you have to do the research, you have to look online. And a lot of times you see the scary and misinformation. And so I'll take a woman in the bathroom so that she can see that what's behind the clothes, because most people, when they see me, they don't see what I've been through. And that can be hard as well, just healing from the journey, because people can't see the scars behind your clothes, behind your smile. I naturally smile a lot, and so I noticed that people could not see behind my smile. But thankfully, I told you Tyler, Texas saved my life. Tyler is a huge medical community. And I know I encountered one person, but that does not speak to the vast majority of the physicians and medical professionals in this area. Well, one of the medical professionals that I'm really good friends with, she's a retired doctor. She understood the mental stress that my body was in my mind was about to undergo. Although I didn't have to go through chemo, I had to go mentally go through all the things that a person with breast cancer or ovarian
Mhm.
cancer had to go through. And so she matched me with a mindfulness coach. And so this mindfulness coach helped me put the situation in perspective. She was a woman as well. And like I said, I didn't want to do reconstruction. The doctors were so confused, especially the plastic surgeon. And I don't know if it was because they wanted more commission if you do reconstruction, but I didn't want to do reconstruction. I felt that I was blessed to know that I had the gene and that I had a 99.9% of never getting cancer if I underwent the double mastectomy. And so, what if that 1% chance did happen? I didn't want to have implants in it. I didn't want the doctors to come back and say that, there's a recall on the implants. I wanted to be okay with how I look without breasts. And so, my mindfulness coach helped me. She was there the very first time that I looked at my chest, and I was about to cry because I had one request, and that it was that my breasts did not look like my grandmother's, that it did not look sunken in. And immediately after my surgery, I wasn't bandaged, but I wanted to get up. I knew in my mind before I underwent surgery that right after surgery, I wanted to get up and use the restroom on my own. I didn't want to be hooked up to a catheter. And so I'm probably 30 minutes to an hour out of surgery, and I asked to be taken to the bathroom. And so when you walk in the bathroom, there's a mirror there, and my gown is open, and I saw my chest, and my chest was sunken in, and so I looked away. It took me several weeks. We had to cover the mirrors in the house. I had a lady with home health come over every day, change my drains, and to give me a wash up. But I wouldn't look at my chest because I know what I saw when I looked in the mirror. And my doctors came in the room, and I said, "Is my chest sunken in, my plastic?" So he was like, "No, no, no. You're minutes out of surgery. So of course it's not gonna look the way it's going to look. And so give it time, give it time." And that's what everyone. So I looked at my husband, I looked at my friends in the room. I said, "Is my chest sunken in?" And they're like, "No, you're fresh off the surgery table. Relax, recover." Well, I needed my mindfulness coach to look with me. My husband couldn't do it because he's a man and he wouldn't have the same empathy that a woman would. And so when I finally got the courage to look at it, my mindfulness coach was there with me, and my chest was sunken in. And I knew it was, but I had to see it. And tears started to well in my eye. And she looked at me and she said, "But you don't have cancer." And it was at that moment that it's okay if your chest is sunken in. Who will see it? Who's going to see it? Um, and so she helped me to mentally process how I felt and how I looked. And so if you're not okay, once you make these decisions and you find yourself in places or situations where it's hard for you to mentally understand, reach out to a medical professional that can help you with your mental, because that's half the battle. It doesn't stop after you make the decision. It doesn't stop after the surgery. You think you're going to be pain free and brave and bold, but that's just the beginning of the journey. And so I wanted to share that to let women and men know, like, continue to get the resources that you need to heal mentally and physically.
I so appreciate you for your strength to be vulnerable and share your story, because your call, your mission is really to help people become comfortable with making choices that can save not only their life but the lives of family members in generations to come.
Yeah.
So I'll let you go with this. You've given tips throughout this conversation, but I do like to ask our guests for practical tips. And
Mhm.
let's say, because there's someone listening to this right now who may have a family history of cancer, or may suspect that there is a hereditary link to cancers in their family. Um, Maybe they've even had genetic testing or hereditary cancer testing suggested to them, but they're hesitant
Mhm.
to go through with it. What are three practical tips that you would say that might help that person build some confidence and to become a more effective advocate for cancer previvorship?
I love it. So the lady who recommended the genetic testing for me also had a family history of genetic testing. And so, although you work in these fields and you have these conversations with people, sometimes you're still afraid to make the decision for yourself. And so, she shared with me that my strength and my ability to act quickly empowered her. And so she recently underwent genetic testing. And I know now that what I went through wasn't just for me. Just in these past 2 years, I have been able to help at least 10 women. And so community is very, very important. Trying to go through things alone, mentally, um, sometimes you're not strong enough to do it by yourself. And so I would say surround yourself with people who understand the decisions that you're trying to make, and not for them to make the decision for you, but to help you. My friends called me and asked me, "What do I need?" And one thing I just did not have the mental capacity to do was to identify what I needed post surgery. And so I told them, "I don't know what I need post surgery. And so I need y'all to do the research." And when I tell you, boxes and things showed up at my door to help me recover well, because I was open with people to say, "I don't know what I don't know. And so I need you to help me in this area while I'm trying to become an expert in this other area," because they were really pushing the reconstruction. I mean, they push and they was like, you can have a whole new boob job. But I knew for sure what I want. And what I see is that, and I'm trying to give tips, but I'm also trying to get it all out so that people are aware. What I see is that experts, not only in healthcare, but contractors and people on the job, are so confident in their ability until they're not. Oh, they are 100% confident that your chest won't look sunken in. They are 100% sure that they can eliminate whatever issue they're having. They're 100% sure that they can climb up to your roof and change it out in one day, until it takes a week, until your breasts are sunken in. And then they'll come back and say, "Well, I never promised." No, you did. And so people make promises. And so being around community, being informed for yourself and not depending on the experts to give you the information. Because if you're informed, you kind of know what to expect. And I knew in my heart what was going to happen to me after the fact. Now, I wasn't expecting a certified letter dropping me as a patient, but I knew how my chest was going to look.
Mm.
So community, being informed, and being bold enough to make the decisions. You know, I share this information, and unfortunately, our community, a lot of women and men are afraid to have the genetic test, and they would just rather not know that they can do something about it. Um, and I say, just get the test and then decide. So those are my tips, and I do want to say that God has empowered me. He put a vision in my mind last summer. He told me that I would not be the expert, and that He would send me the resources and people that I need to be successful. And as you can see, I naturally smile. Yes, He'll do it. I naturally smiled, but life just kept coming at me left and right, front. I mean, I'm knocked all over the place. And I had moments, and still now, I have moments where I'm tested. I am tested, and we often say that something bigger is on the other side of the test. But when you're in the test, it's hard. And I had moments where I literally felt like I was gonna lose my mind. I wasn't suicidal, but I just felt like I was going to lose my mind because it was one thing after another, not with just healthcare, but it was like attacks on every front, family, financially, emotionally. And so I felt my smile leaving. I felt my joy
Mm.
leaving. But my husband has been steadfast throughout all of this, and life is happening for him as well. But he has truly been my helpmate. And so he would call me while he was traveling. He would say, "Hey, Sparky." And every time he called me Sparky, I would smile. And so fast forward, God gave me a vision to start a company. And I named the company Spark Life Again.
Mm.
And what Spark Life Again is it's a national nonprofit. I'm going to speak life into it and give it the way that God gave it to me. It's a national nonprofit organization that brings the spark back to people's lives. And it's twofold. It's patient advocacy to help walk individuals through the healthcare industry. I want to be one on one, and not just myself. I want to have people around me that can help walk people through their diagnoses. And I want to provide this free of charge. I want grandmothers and grandfathers and aunts and uncles and cousins and young people to call us and say, I don't know what they just said to me. All I heard was cancer. All I heard was tumor. And I don't know what to do. Because you have a hard time getting appointments, you have a hard time getting medications. And so I want to walk them through it. I don't want them just to hear diagnoses and then go have to be an expert and find your physicians. But then the other one is the Spark Line. The Sparkline is a national hotline where individuals can call in. They'll be connected to a live operator, and they can just talk about whatever their issues are. They don't have to identify themselves, because I want high profile individuals, middle profile individuals, or just any individual to be confident, men as well, to call in and not have to say, I'm Veronica Tucker and I'm stressing out and my mind is spinning. I just want people to be able to call in, be connected, and talk through the issues and give them practical steps to redirect their minds. And so that's my final recommendation is the Spark Line, and it's still up and coming. But that is my gift to the world.
If you believe, so be it unto you.
Mhm.
And you've got an ally here at Genetics for Healthcare. And it also, Veronica, sounds like you need a podcast.
No, I'll just be a guest.
Well, whenever that is up, let us know, because we'd love to have you come back and talk
Yeah.
about, and let's dig into your vision and the
Mhm.
organization that you just talked about. This the Spark Line, you said Spark
Yes,
Line.
yes. So Spark Life Again is a big umbrella company, but the Spark Line
Okay.
is the hotline. And with the Sparkline, we want to be able to connect your podcast to that because people need a way to get resources. And so, absolutely, there's a partnership where we can connect because I wasn't called to do podcasts. He called me to start Sparkline and to do patient advocacy. And you're providing the information, you're sharing the stories, and you're bringing the people. And so all of it works together for the good.
Come on now.
Yes.
Listen, uh, powerful, powerful testimony. Thank you for sharing your story, and thank you for the light that you're
Mm.
shining. You do smile a lot, but that is a part of the light that you share with the world, and I really thank you for sharing that with our audience here on Genetics for Healthcare.
Thank you.
Real quick, okay, so Delta, did you pledge as on campus?
Alumni chapter 2019 in Huntsville, Alabama.
Okay,
So
all
yeah,
right,
just a couple of years ago, but it has been fantastic. The sisterhood, and I did it at a point in my life when I was confident in who Veronica was. But I love helping people. My life goal has always to been able to help people. I have my MBA, uh, but at the core of who I am as a person, it's all about helping people. And so in 2019, I pledged, but the sisterhood has been so fantastic and life changing for me in
life
so many
changing,
ways.
absolutely.
Yeah.
Yeah, I love it. I
Yeah.
love it. Thank you. And we want to hear you back as
Mhm.
your vision takes off.
Yes.